This diagram lays out two distinct paths to relieve pain. Analgesics, which modulate perception and reduce inflammation so people can stay functional, and anesthetics, which interrupt nerve signals or induce temporary loss of sensation or consciousness to enable procedures. Think of the nervous system as the central tree where these two approaches either dampen signals or block them entirely for different clinical goals. In simple terms, analgesics act as the pain manager, easing discomfort so daily life can continue without losing consciousness, while anesthetics are the surgical interventionist, designed to prevent pain before it starts and allow invasive treatments. Both aim to control pain, but they differ fundamentally in timing, intensity, and how directly they act on nerves or the brain. There are several families within each approach. Analgesics include common non-opioids like acetaminophen and ibuprofen for everyday aches, opioids reserved for severe pain, and topical agents applied directly to the skin. On the anesthesia side, the scale ranges from local numbing for minor work to regional blocks for larger body areas, up to general anesthesia that renders the patient unconscious for major operations. Analgesics interrupt pain in two main ways. Non-opioids like NSAIDs target the source by blocking the COX enzyme and cutting prostaglandin production, which reduces inflammation and swelling, while opioids work centrally, binding to receptors in the brain and spinal cord to lower pain perception and trigger dopamine release, which also contributes to feelings of comfort and relaxation. Anesthetics stop sensation more definitively. Local anesthetics temporarily prevent nerves in a specific spot from sending pain signals. Regional techniques inject near nerve clusters to numb an entire limb or region. And general anesthesia is a controlled, multi-stage process that alters the central nervous system to produce a reversible, unconscious state, while vital signs are closely monitored throughout. Choosing the right tool depends on the need. Analgesics are ideal for everyday pain, fever control, and inflammation management, helping people stay active while symptoms improve, whereas anesthetics are essential for medical and surgical procedures. From dental work to childbirth, where preventing pain quickly and precisely is critical to both comfort and safety. Both analgesics and opioids carry risks that must be weighed. Non-opioid side effects can include digestive upset, kidney or liver concerns with long-term use, increased bleeding risk with aspirin, and allergic reactions, while opioid risks include drowsiness, constipation, dependence, or addiction, and potentially dangerous respiratory depression at high doses, so careful use and medical oversight are important. Anesthetic risks vary by scale. General anesthesia commonly causes temporary grogginess, nausea, or shivering, and rarely triggers allergic reactions, which is why continuous monitoring by an anesthesiologist matters. Local and regional techniques can produce temporary numbness, injection site bruising, and in rare cases, nerve injury that may cause longer-lasting tingling but usually improves over time. Hearing patients' stories highlights how these approaches play out. Some, like a working parent, rely on over-the-counter analgesics alongside physical therapy to return to daily life, while others need prescription plans to balance relief and side effects. And surgical patients often describe relief from anxiety and no memory of the procedure, thanks to clear anesthesiology care and precise local numbing. Safety is paramount, and responsibilities are shared. When using analgesics, always read labels. Follow recommended doses. Check for drug interactions. Be mindful of allergies, and consult a healthcare professional if pain persists. When anesthetics are planned, professionals take a detailed history, continuously monitor vital signs, choose the appropriate agent for the procedure and patient, and observe recovery closely to ensure safe outcomes. Looking ahead, pain management is becoming more personalized and precise through trends like tailoring treatments to genetics, using wearable digital tools that track pain and give real-time feedback, and integrating holistic approaches such as physical therapy and mindfulness. Emerging possibilities include gene therapy, regenerative medicine with stem cells, and virtual reality techniques to alter pain perception and improve patient comfort. If you want to learn more, start with authoritative textbooks such as Pharmacology for nurses and explore academic journals like the Journal of Pain and Anesthesia and Analgesia for current research, while online platforms like Coursera and EDX offer structured courses in clinical pharmacology and perioperative medicine, and visual resources like Khan Academy provide short, digestible videos to clarify complex concepts.